Are we testing for COVID-19 in Daylesford, Trentham and Kyneton? Yes, Springs Medical is testing for the COVID-19 virus, but only at our Daylesford campus and only for those patients who've been recommended to have testing according to the Commonwealth Government criteria. That is, we're only testing those people who have returned from overseas in the last 2 weeks and are unwell, those people who have had contact with a known case of COVID-19 and are unwell, or for healthcare workers who are unwell with a fever and respiratory illness and the temperature is over 37.5. Outside of those criteria, we are not testing for the COVID-19 virus. As I mentioned, all our testing will be occurring at the Daylesford campus. Please make it clear that we are not testing people who have a minor cough or cold who are outside of those high risk criteria, and we are not providing testing to enable you to return to work to be given a clearance. We're also not testing, in fact, if you are severely unwell, critically unwell. In that circumstance, we would be likely to transfer you directly to Ballarat Base Hospital, where you could be seen and tested at the same time. To repeat, we are only testing those people who are not critically unwell, who meet the criteria recommended for testing for COVID-19. What do I do if I have a cough or fever or runny nose or sore throat? Currently, if you have a cough or fever, runny nose or sore throat, and you don't meet the high risk criteria for COVID-19, you will not be tested. If you are not particularly unwell and don't think you need the care of Springs Medical, then please self-isolate at home and wait for your illness to pass. If you would like to have some medical attention, then rather than arriving at Springs Medical, we encourage you to call first, and in many cases you will be able to be managed through a doctor phone call. So our intention is that all patients who have respiratory illnesses or fevers will receive a phone call from the doctor to determine what the best management is. It may be that the management can be just that you continue at home, or alternatively that you need to be seen. If you need to be seen, we will ask you to attend Springs Medical, but and then making a phone call from the car park before you attend. What happens when I arrive at Springs Medical? When you arrive at Springs Medical, after you have had your initial telephone triage assessment, you will call the receptionist, and one of two things will happen. If we have assessed that your risk of having COVID-19 is extremely low, you will be asked to come into the building through the normal entrance, to put on a mask and sit in an isolation room and before you are seen by the practitioner in the normal way. If we determine that you are at high risk and need to be assessed and or need testing for COVID-19, in this case we will ask you to call from the car, and after you have called you will be taken around to a side entrance of Springs Medical where we can take you into a specially set up isolation room to be seen. The doctor who sees you will be wearing full personal protective equipment. That is, the doctor will be wearing a mask and goggles and gown and gloves when they see you. And if any testing is needed to be done, it will be done at that time. So again, when you come to Springs Medical after you've had your telephone triage, please call from the car park and we will arrange to see you after that. What about after hours? Springs Medical is continuing to provide a 24-hour medical service through Daylesford Hospital, and you contact the after hours service through the usual telephone numbers. In this time with increased risk from respiratory illness, we ask that if you have a respiratory illness or a fever, that rather than just coming into the hospital, you call the hospital before attending. The hospital does also have a special isolation room. What if I have routine care needs? Springs Medical is continuing to operate business as usual. As we have described, we are taking some extraordinary measures to ensure that patients with respiratory illnesses are not seen within Springs Medical other than in an isolation setting. For this reason, we believe that attending Springs Medical remains a safe activity for our patients. However, if you have concerns, it may be possible that you can be managed through telehealth. That is, the doctor may be able to call you and manage your condition or manage your problem or provide prescriptions or order tests through after conducting a telephone consultation. So if you are concerned and would rather have a telephone consultation, please contact Springs Medical and we will determine if we can provide that service for you. What if I'm not a patient of Springs Medical? If you are not a patient of Springs Medical, and particularly if you are just visiting the area, it is probably best that you contact your usual general practitioner to obtain care, because they will know your full medical history. If you are a resident of Daylesford but have as yet not attended Springs Medical, we will see you, but when you call, we will first obtain your name, date of birth and Medicare number so that we can create a file, a clinical record, so that when the doctor calls you, we can keep a record of that telephone consultation. Finally, I would like to say that we are doing the best that we can in extraordinary times. It has been a particularly stressful time for the whole community, and particularly for health professionals at this time due to increased demands on our services. We are meeting every day and we are altering the way we have set up our appointment book, the way doctors are available. We've increased staffing. We are doing everything we can to try and meet the challenge, if we can all meet this together. During this time, sometimes the service may not go as smoothly as we usually provide or as you would like. Please be understanding, and most importantly, during this stressful time, it's important to remain civil and to treat each other with respect. Thank you.